4 Canadians are returning home to British Columbia tonight after weeks aboard on the cruise ship hit with a hantavirus outbreak that claimed 3 lives. They disembarked early this morning from Spain's Canary Islands before taking a flight to Quebec. They then changed planes before flying to their final destination, BC. Provincial health officials say they will be medically assessed upon arrival and then will isolate with daily check-ins until the incubation period has passed. Right now, none of the 4 are showing any signs of infection. CBC's Sheehan Desjardins leads off our coverage and joins us now. Sheehan, it's been quite the journey for these passengers, Spain's Canary Island to Quebec to BC. So tell us a little bit more about this trajectory.
Yeah, certainly quite a journey. After weeks of being stuck on that ship, they finally got off the ship. They boarded a chartered plane landing just about 2 hours north of Quebec, and that plane has touched down. Now they're expected to get on another plane. That plane headed to British Columbia. So we don't have too many details about the people who are on this plane, about the 4 Canadian passengers, but what we do know is they are expected to land in BC. That's their final destination, and we also know that they have ties to BC, which is why they're heading there.
Okay, so that's a little bit more information than we had a few days ago. Now, how is BC preparing to bring them in and, of course, care for them and keep them safe and keep them from engaging with broader community for now?
Yeah, certainly. So Global Affairs Canada did say that they were asymptomatic when they left Spain. But all that to say is health authorities, local health authorities in British Columbia are going to be reassessing these 4 Canadians once they get to BC. After that happens, they're going to be going into isolation. They will be self-isolating. They already have locations decided for that. And they will be there for a minimum of 21 days. Now, once again, that is the minimum, 21 days. And we heard from Dr. Bonnie Henry, that's the provincial health officer, spoke earlier today and said they don't have this strain of the virus in British Columbia, but if these passengers do develop symptoms, they are equipped to handle it.
We're well prepared. We have protocols to be able to safely do assessments and testings, and we have special clinical capacity to safely assess and care for somebody, even with a potentially severe disease like hantavirus. And that includes, if absolutely necessary, we have a specialized biocontainment unit treatment center at Surrey Memorial Hospital.
Obviously, there's a lot of anxiety with these passengers arriving, but she did stress that they will not have any contact with the public. She says that the isolation period could be extended. That all depends on what the situation is looking like at the end of that 21 days, but also really talked about how this has been such a hard time for these passengers. They've been through such a journey. They're looking forward, obviously, to getting home, and they're expecting to provide another update on the situation and how it all goes in BC tomorrow.
And certainly we've been talking to other experts as well, and they've all said that from what they've seen so far, this has been textbook handling of the situation on part of the public health authorities. Sheehan, thank you so much for that.
Thank you.
That's CBC's Sheehan Desjardins. So what happens next for these Canadian passengers, and is the risk of transmission over yet? Let's bring in Dr. Isaac Bogoch. He's an infectious diseases specialist at the Toronto General Hospital. Dr. Bogoch, thank you so much for making time for us on Mother's Day. And if I may say, happy Mother's Day to your wife. Hope your family had a nice day today.
That's very kind, Deanna. I was actually going to wish you a happy Mother's Day as well, but you beat me to the punch. I hope you're having a wonderful day too.
Thank you so much. It was a very nice day indeed. And I wanted to ask you, I was just thinking that our viewers will see you, and they saw Dr. Bonnie Henry just about a minute ago in the broadcast. And I think that'll bring back some memories from a few years ago. And everyone is reassuring us that this is not that kind of situation. When people do have those feelings, first of all, before we get to the specifics of these 4 individuals, is it merited? I think that the word that Lenora Saxinger used yesterday is that people have almost like a PTSD response, saying, hey, all these infectious diseases docs are up again. Is this going to be another pandemic? How much should people worry?
People can worry as much as they would like. I think it's just important to provide people with the appropriate facts and context, and everyone's going to have their own risk perception and risk assessment. Having said that, this is not COVID-19. It isn't. This is a known pathogen. We've known about this particular organism for about 30 years. There have been prior outbreaks with this type of hantavirus in the past, most recently in Argentina in 2018. Every one of these outbreaks have been quelled with routine public health measures, just like we're seeing right now. And I think if everybody does their part, and it's a bit more challenging now because it's an international outbreak and there's more contact tracing involving multiple countries, but if everyone does their part and adheres to the same sound public health measures, this will be quelled sooner rather than later.
Okay, that is, I think, very comforting for people to hear. I want to talk to you a little bit about the WHO, which has recommended a self-isolation period of up to 45 days, which is quite a bit for those who may have been exposed to that specific Andes strain of the hantavirus that was on the cruise ship. But in terms of enforcement, this is what one official said today.
Of course, countries, we advise them, but at the end of the day, we don't impose. Countries follow their national guidelines, and based on the risk assessment, they can implement. But our guidance is very clear, and it has already been released.
So that's the WHO guidance, but he did say that different jurisdictions are taking different approaches. We've noted that BC has a minimum of 21 days with also regular assessments, but others like Ontario are recommending 45 days. What gives? Why is there such disparity between different places?
So 2 points here. One, the WHO is spot on. They don't impose, right? They can make guidelines, but they have no jurisdiction in the various countries and, of course, provinces in Canada. The second point is it's frustrating to see disparate guidelines under the same umbrella in Canada. We saw that multiple times during COVID. That fosters confusion and occasionally mistrust in public health. We should have a standardized approach to this in the country. I appreciate Canada's a big place. We don't have one healthcare system. We have 10 healthcare systems, but we should really have this standardized in our country. And then the third point is, yes, as always, multiple people can look at the exact same data and come to slightly different conclusions. We've seen that time and time again. Those are 3 points that don't necessarily contradict each other, but I think from a trust, from a standardization standpoint, we should have one common guideline for how this is managed in Canada.
That's really interesting. Thank you for letting us know that. Tell me from the protocol standpoint, what protocol needs to be followed now with these individuals in BC to minimize the risk of transmission?
The key thing here is just monitoring for symptoms. It's a bit of a, hurry up and wait, right? These people may have been exposed, and most of them will likely, keyword likely, not have any issue. Having said that, in case they do, it's important that they're monitored for symptoms, and it sounds like people will be checked up on once a day. And if they have symptoms, they'll get a prompt medical care. The other issue, too, is, of course, if they develop symptoms, they could be transmissible to others, and that's why the isolation is so important, so that there's no inadvertent transmission to other people. This is a fortunately rare, but unfortunately very deadly virus that has mortality rates upward of 20, 25%, sometimes more, depending on the outbreak. So we clearly want to minimize any exposure to other people. That's why it's important for the daily monitoring.
Dr. Bogoch, according to Canadian officials, passengers are, as you noted, asymptomatic for now. But we do know that this virus has a very long incubation period. How big of a problem is that? And how likely is it that symptoms could surface eventually, even weeks from now?
Yeah, I think that's exactly the point. And currently there are 8 cases. There are 8 cases to date. There's likely going to be more, right? There's some people who are probably exposed, who are incubating the virus, who have no symptoms whatsoever, and who unfortunately will likely have symptoms of the virus in the days or even weeks to come. That's probably going to happen. And as you point out, that's because it has a long incubation period. Having said that, that's why you have this long isolation or quarantine period to account for the long incubation period, such that if people do develop symptoms, it will be during their period of isolation or quarantine. And that's the whole point. And of course, that's why they're monitored daily. The other important point, too, is prompt medical care, right? Yep, there's no targeted antiviral for this very serious virus. Having said that, with appropriate medical care and supportive oxygenation, sometimes even the use of an intensive care unit, people can get the care they need to give them the best opportunity for success if they do have this virus.
Dr. Bogoch, thank you so much for sharing your analysis with us. And I know that you'll probably be talking to us in the weeks to come as this story develops. Thanks so much for your time.
My pleasure.
Dr. Isaac Bogoch is an infectious diseases specialist at Toronto General Hospital.